Hello everyone, welcome back to my YouTube channel, My Cup of PT. In today's video, I will be covering a very important topic with you guys, that is orthopedic assessment. So starting with the demographic data. What does demographic data includes? It includes the name of the patient, his age, his gender, his occupation, as well as his address. And the date should be mentioned first and the foremost because you have to maintain the patient record. Okay. Then chief complaint. Chief complaint is something that you have to write in the patient's language, not in your language. Not any medical terminology should be used. Okay. Like I have written here, pain in right shoulder, not able to sleep properly at night. Instead of writing insomnia, okay, you should write not able to sleep properly at night. This is something the patient has told you. Then what you can do is you can write how long, since, how much. Okay, 3 months, 4 months, whatsoever patient tells you. Then coming to the history, present history is there, pain history, past history, family history, and other histories are there like socio-economic and others. But now I will be focusing on the present history. In this, you can allow the patient to narrate the history. He will tell you that he was apparently doing well, and you can write in this way that patient stated he was doing apparently well. One day suddenly he fell in his bathroom on his right shoulder, and he was given a conservative treatment from a nearby hospital. Now this is what patient will be explaining you. Okay, this is I am telling you in a hypothetical way, but you have to ask your patient. You have to listen your patient. That is very important, because then only you will come to the final diagnosis, and from that diagnosis only you will able to make a right treatment plan. And if the treatment plan will be made according to the correct diagnosis, then only prognosis will be better. Okay, otherwise you will be able to see very slow recovery of the patient or no recovery of the patient. Okay, so assessment plays a vital role in physiotherapy or in any medical field. Assessment is the foundation. Okay, so present history allowed to narrate the history. Patient is allowed to narrate the history, date of onset of the symptoms. You have to mention how long it has been, and mechanism of injury, how did he fell, mode of onset, condition, improved, stationary or deteriorated, and then the muscle weakness. I would mention, like, no need to mention any muscular weakness or something like that. Just explain the everything in a paragraph that patient will tell you. Okay, then pain history. Pain history include these 3 points: onset, side. So onset can be gradual or insidious. Okay, let me mention here. Onset can be gradual, like gradually he is having a pain, like it's increasing eventually, or insidious. Got it? Then coming to the side. Side explain anterior part of the shoulder or posterior part of the shoulder. Okay, lateral, anterior. That in that way you have to write A, P, or L. I have written that anterior, posterior, or lateral. Then side. Side means which side? Is it right side? Is it, like in this case hypothetically I have taken that right shoulder is affected. So is it right or left? Side means right. Just wait, right or left. Got it? So this is how you can mention about the pain history, onset and everything. Then you can write about the duration, type of pain. Type of pain, if you remember in David Magee, it is given very nicely that which pain is responsible for, like if dull pain is there, so it is basically the muscular pain. If sharp shooting pain is there, then nerve pain. Okay, your basics should be very strong while taking the assessment. Then aggravating and relieving factor. Aggravating means what is aggravating the pain of the patient. He will tell you when he is doing his activity of daily living, while brushing his teeth, while combing his hair, he is facing that he is like this is something that is aggravating the pain. And what is relieving is rest, keeping his arm adducted to his chest. Okay, that things are relieving his pain. Then past history. Any tuberculosis history, any bronchial asthma, BP, diabetes, cardiac problem, anything that is there as a medical history of past should be mentioned clearly, so that there is no confusion while doing the assessment of the patient. Okay, even in this pain history I would like to add that you can also write the severance of the pain, and you should clearly mention that which scale you have used. If I am writing 6 out of 10 in this, I hope you guys know that I am writing the score that patient will be explaining. You will ask the patient out of 10 rate your pain. So he tells you, if he tells you 6, then you have to write it 6 out of 10. With bracket you have to write VAS scale. Okay, VAS scale, because I will be mostly people use, or mostly we physio use VAS scale because it's easy to explain and as well as also valid test for pain. So it's good. Then past history, any bronchial history, any bronchial asthma history, tuberculosis, if they are, just wait, if it is there, you can write. Then family history. In family history, you have to write any genetic problem, or if you think it's not there, then you can write not relevant. Okay. Then personal history. In personal history, it includes all the addictions. So in personal history, you can write the addictions and everything. If he is having cigarette, number per day, how long, and if he is alcoholic, how much amount he is taking per day. Okay. Socioeconomic. For socioeconomic history, there is one scale, Kuppu-Swamy scale. So you can use and write it, that upper, lower middle class or upper middle class. Okay. Then coming quickly to the medical history, what present medication patient is on. So if the patient has past history of this tuberculosis or the diabetes or the hypertension, so you have to mention how much dosage of the, firstly you have to mention medicine name, then you have to mention the dosage so that it can be clearly explained. Just wait. In dosage you have to write BD or OD. OD means once a day, BD means twice a day. Okay. So this is all about today's video. In next video I will be covering the other parts. Thank you.